Welcome to Grand Rounds for September 24th, 2025. So this month we're lucky to have a second Grand Rounds. This one is on performance recovery nutrition for active individuals, and specifically physical therapist role, but also occupational therapists and speech therapists, and because it is open to all providers and including physicians as well. Uh, So Elliot Beadle is a sports and performance dietitian at St. Luke's University Health Network. He brings nearly a decade of experience in sports nutrition and weight management. He earned his bachelor's degree in nutrition and dietetics from Westchester University of Pennsylvania, as well as his bachelor's degree in exercise science from Bloomsburg University in Pennsylvania. With dual degrees, Mr. Beadle combines a deep understanding of human physiology with evidence-based nutritional strategies to support athletic performance and overall health. As a registered dietitian and ACSM certified exercise physiologist, Elliot Beadle specializes in translating complex nutrition science into practical guidance. He leads both group and individual sessions on topics such as sport-specific nutrition, nutrient timing, body composition optimization, energy needs assessment, and sports supplement evaluation. Passionate about health and physical activity, Mr. Beadle is dedicated to empowering others through education and personalized support, helping clients and patients fuel their performance and achieve their goals. So just some housekeeping, make sure you sign in with the code at the top left or the QR code on the middle top. I also put them in the chat if you missed this first slide, and make sure that you do that prior to tomorrow at 12:30. The description of need is, the activity description is here, and it is for all providers, as mentioned before. This is the St. Luke's University Health Network designation statement, and the planners and presenters have nothing to disclose. And also at the end of the presentation on EADS, you will take the quiz and the course evaluation in order to get CME or CE credit as appropriate. These are our learning objectives, and without further ado, I will turn this over to Elliot.
Great. Thank you, Steve. Thanks for having me. So for today, we're going to really talk about nutrition needs when it comes to the recovery process and what it looks like compared to when they are actively engaging in sports or physical activity. We'll talk a little bit about macronutrients and what that's going to look like if we need to be adjusted, and then we'll also address a little bit further some of the dietary supplements. So not too much information now because we're going to go through all those things individually as we go along. So the importance of the presentation for today is I know for myself, I've gone through physical therapy. I've done it for high school, and I've had a number of injuries over the years. And I know that physical therapists do a lot of connection with their patients, and they get to know their patients really well. They have a really good ongoing relationship with them. And they do tend to have conversations a lot about things like, what did you have for dinner? Or what's your favorite food? Or people oftentimes ask about what should I be eating for my recovery? And, should I eat this food? Should I take that supplement? There's a lot of things that may come up in everyday conversation with your patients that I feel it may be beneficial to have a good understanding of what nutrition looks like for recovery. Now, with this, I'm not expecting anybody to be able to one-on-one counsel a patient very well regarding their nutrition, but to be able to have some general guidelines and to really be able to know when they should be referring to a registered dietitian. So I will say at the end, I'm going to do a little bit of a shameless plug. I'm going to talk to you about how to refer to a dietitian, specifically a sports and performance dietitian. So we will go over what that's going to look like at the end for anybody who does want to send a referral over. So as I mentioned, with physical therapist or with any real provider, you're building a relationship with your patient, you're having conversations. You may be the first one to realize and identify that somebody may need a little bit more information regarding their nutrition. So a lot of times with injury and with recovery, you may see individuals who are intentionally or unintentionally trying to lose weight while they're injured. So they may just be drastically reducing their intake, not knowing what they should be eating, but eating a lot less. And then you may see that they are starting to lose weight and maybe lose muscle as they are recovering from their injury. You may also see people who are just not eating meals or skipping breakfast, or because they're not playing their sports or they're not as structured, they are not eating as regimented as they were before. Or you have people who maybe were told that eating certain things like gluten or meat or dairy will cause extra inflammation. So then they're completely avoiding certain food groups and then missing out on the nutrients that are included in those food groups. Or they may be, again, coming to you asking about certain supplements or, hey, my friend's taking this, or I read online I should be taking that. And those are all things that might be a little bit of a red flag when it comes to the recovery process. So those would be good ideas of when you might want to refer somebody to a dietitian. So again, some of them may be just general questions, but some of them may be a little bit more specific where it's beyond your scope to address that. Now, that could be the first place where you just say, okay, that's a good question. You can go see a dietitian. There are also validated tools that you can actually use that will help with identifying if somebody has a little bit more of a nutrition concern. So I have 3 of them listed here. I'm going to go through each one of them, just talk a little bit more about them. If you don't feel comfortable, you don't have time to use these validated tools, that's completely understandable. But if you feel comfortable and have the time, I would encourage you to look these tools up. They're all free access online. And if you feel comfortable, you can definitely use them. So you have Rate Your Plate. We have the LEAF Q and the LEAN Q, so it's low energy availability in females and males questionnaires. And then we also have what we call the Red S screening tool, which I'm going to talk a lot more about that when we get a little bit further along. That's the Relative Energy Deficiency for Sport screening tool. So the first one's called Rate Your Plate. Again, you can find this online. You can download it. It has been validated, and it's just very basically very simply talking about how well somebody's diet is balanced. Are they eating a good combination of healthy foods? Are they restricting certain foods? Are they not having enough vegetables? Are they missing their whole grains? Are they avoiding any kind of animal products or any kind of animal proteins, I should say? And then from there, it'll give you a scoring guide that you can use to help determine, do they have a very well-rounded, very balanced diet, or are they missing certain things that they should be having on their plate? And then it does give you talking points and allows you to help set goals. It does give you a very fairly easy process of addressing some of those nutrition concerns. So yeah, it's something you can look up online and download and give out to your clients if you're interested. The next one we have is called the LEAF Q or the LEAN Q. So again, it's low energy availability in females or males. And this is geared towards more active individuals, which is where I spend most of my time talking for performance nutrition, is with people who are competing in sports or athletic events. So it does address what's your highest level of academic or with your athletic success. And then it goes into more specific areas that could be affected by the low energy availability, such as reproductive health, menstrual cycle abnormalities. It goes into things like recurring injuries. It also talks about any kind of gastrointestinal concerns, things that could be directly related to underfueling as somebody is recovering from their injury. So again, you can download that, share it with your patients if you're comfortable. And then the last one relates to what we call the Red S screening tool. So Red S, again, I will talk about that a little bit more. It's taken over for the female athlete triad. It's much more broad as far as what it looks at and includes males and females. You'll see that they do have male and female specific questionnaires, but it does go through not only the completeness of their diet, but it also looks at things like their propensity for injury. It looks at their relationship with things like their body composition, their body weight, how comfortable they feel in their skin, do they have any kind of eating disorders. It helps to screen for relative energy deficiency. So if you do, again, feel comfortable looking this up, you can provide this to a patient, and then you can use this as a tool for determining if they need to be referred to a sports dietitian or like a primary care sports medicine physician, somebody who'll be able to address the energy concerns a little bit more in detail. So the big thing we're looking at with this is just really looking at the energy that somebody's taking in overall, not specifically looking at the breakdown of it being a carb, a fat, or a protein, but just are they underfueling their body? One of the big misconceptions when somebody's injured and they're recovering is that they need to drastically or dramatically drop their energy intake because they're a lot less active. But what other people are forgetting or not understanding is that they still need injury for recovery. So there is a lot of extra stress put on the body. There's a higher demand for certain nutrients when we are injured. We need to make sure that we are meeting those energy demands. So just to give you a rough idea, and these are very general recommendations, most active individuals, people who are playing college or high school or recreational sports, or people who are maybe training for a race, a marathon, something like that, they typically require roughly 40 to 50 calories per kilogram of body weight per day. Now that's for active individuals. A typical non-active individual may need about 25 to 30 calories per kilogram of body weight per day. So active individuals typically need about 1.5 to 2 times as many calories as non-active individuals. But when we're injured, we don't just drop down to what a non-active individual is consuming because, again, we need the extra energy for recovering from the injury, for preserving muscle mass, for the rehabilitation we're doing. So our energy demands may slightly decrease, or for some people, depending on how active they are before they start before the injury or how intense their rehab is, they may see a very minor decrease in their activity, if any at all. So typically for injury recovery, they're requiring between about 30 to 45 calories per kilogram of body weight per day, but that really goes by the severity of the injury. Is it just a sprain or a strain, or is it a break, or are they immobilized? Is it an upper body injury or a lower body injury? Is it the initial phase of recovery, or is it 6 weeks into recovery? There's a lot that go into it, so we have to make sure that the athlete understands they're not just drastically decreasing their calories. They do need to consume, again, maybe slightly less calories, but more calories than the average person. What we find is that when somebody does consume less than about 25 calories per kilogram of body weight per day, especially as an athlete going through physical therapy or the rehab, that does tend to increase the chances of muscle wasting, and it can lead to the low energy availability, which we are concerned with a lot of active individuals. So the concern is if we are underfeeding, it's going to delay the healing process, it's going to increase the risk for muscle loss, and it's also going to increase systematic inflammation, which can delay the recovery after a workout or cause reoccurring injuries down the road. So one of the biggest concerns we have for active individuals is the risk for what we call low energy availability, LEA, or RED-S, which is relative energy deficiency for sports syndrome. So I'm not going to go too detailed for this today. This is something that definitely it's good to know about when you are working with active individuals. There's a lot of resources online for it, mainly from the International Olympic Committee, but it is something good that you want to be familiar with because this is something that can happen before the athlete gets to you in the first place, or the active individual. It can happen while you're doing the therapy or the rehabilitation, or it can happen after it's done. I actually worked with somebody recently who she was eating well before she injured herself. During injury, she drastically reduced her intake. And then when she got back to playing sports, she wasn't sure exactly how she was supposed to get back to eating normally because she was used to restricting her eating, thinking she didn't want to gain weight while she wasn't playing her sport. So it's something we want to be very aware of. So it's relative energy deficiency for sport. It is a continuation of the female athlete triad. Basically, what it's saying is that active individuals are not consuming enough energy to sustain their physiological function because we're prioritizing more energy for our physical activity and not leaving enough energy left over for the body to sustain other physiological functions. So there is a formulation for it, which is very hard to actually calculate unless you are very comfortable with it. But the equation is taking into account their overall energy intake minus the energy they're expending for physical activity or energy, dividing that by their kilograms of fat-free mass per day. We find that if they're consuming less than 45 calories per kilogram of fat-free mass per day, minus what they've taken in, minus what they've expended for their exercise, that tends to be a low energy availability state. So when individuals are consuming less than that 45 calories per kilogram of fat-free mass per day, we tend to see decreases in athletic performance. We see decreases with mental acuity, muscle strength goes down, athlete availability decreases, the time to recovery increases as well. So we do see a lot of sport-specific or activity-specific concerns as somebody starts to present with that low energy availability. The bigger concern comes after they've been following that low energy availability state for a longer time. That's when it starts to impact things like their reproductive health. So we see concerns with the menstrual cycle for females or testosterone level for males. We see it impacting their bones because estrogen is very protective of your bones. If you're not having a menstrual cycle because of low estrogen production, that can then lead to increases in the stress fractures. We also see concerns with the lipid metabolism and our glucose metabolism. So healthy individuals have high blood pressure or high cholesterol or elevated glucose levels. We see decrease in their mental function. We also see increase in the risk for depression. We see concerns with the incontinence, and then also the immune system tends to be compromised as well. So as active individuals, we have to make sure that they are fueling properly. We have to make sure that they're not drastically reducing their energy intake because it could be something that impacts them now as they're recovering, or it could be something that carries over once they hopefully get back to being more active in the long term. So low energy availability, relative energy deficiency for sport, those are things that you want to be aware of, and those are things that you definitely want to refer to a dietitian or again a primary care sports medicine provider if you feel that is something that an athlete may be suffering from. It could be what they brought you in the first place if it is a reoccurring injury, so it's something good you can address with them while they are rehabbing. Now, to give you an idea of what a dietitian would do, and this is not I'm expecting anybody here to do, but we would do a very detailed analysis of what their energy demands might be. So we're going to calculate what is their resting energy expenditure. We have different calculations that we use to determine how many calories the body's burning at rest on average. We then add in the physical activity level based off of how active they are with their rehab, if they're still engaging in some kind of sports, they have an active lifestyle outside of sports. So we'll add an activity factor for that. And then we also added a stress fracture depending on how severe the injury is, whether that's recovering from surgery, if it's a bone fracture, if it is a different kind of musculoskeletal injury, we can look and see roughly how many extra calories they'll need for the recovery process. So this slide is just basically to show you that there's a lot that can go into it. I'm not expecting anybody on here to actually calculate energy needs for someone, but just to give them a rough idea, giving them an idea, you may need 30 to 40 calories per kilogram of body weight per day, gives them a rough ballpark to where to get started so they know that they're getting enough energy throughout the day. Now, as far as the breakdown of the nutrients, we focus mostly on our protein. So everyone knows that protein builds muscle, but a lot of times we forget about all the other functions that it plays inside the body. So it's important for growing hair, skin, and nails. It's important for repairing your bones. It's also important for the immune system. So as we're recovering, we actually have a higher demand for protein than the average person or even the average athlete. So the recommended daily intake for protein is 0.8 grams of protein per kilogram of body weight per day, but that's to prevent any kind of muscle wasting or protein deficiency. Most active individuals would be needing to consume at least 1.2 to 1.6 grams of protein per kilogram of body weight per day to build and maintain lean tissue. They do find that the optimal protein intake for building and maintaining muscle for most active individuals is right around 1.6 grams of protein per kilogram of body weight per day. Now, that's for somebody who is generally healthy, active, maintaining muscle. Somebody who is recovering from an injury and may need to or may need a higher protein demand can go as high as about 2.2 grams of protein per kilogram of body weight per day. And that would be to sustain their muscle mass and to aid in the recovery process. But it's also going to be important because we're going to need to reduce our overall calorie intake for some individuals, and eating more protein will allow them to not feel as hungry if they are eating less overall calories, but they can eat a higher proportion of that from the protein. Now, with protein, our big objective is that we want to spread our protein intake throughout the day. They do find that small, consistent doses of protein work much better than 2 to maybe 3 large doses. So even though we give a goal of 1.6 grams of protein per kilogram body weight per day, if they can do 0.4 grams of protein per kilogram body weight per day 4 times a day, that actually tends to show the most benefits for the individual. So as it shows on the next slide, breaking it up throughout the day is ideal, not lumping it at specific times throughout the day if we can. Ideally, the goal is to get at least 20 to 30 grams of protein per feeding, especially focusing on the pre and the post rehab phases, because that's when the body's more susceptible to using the nutrients and absorbing the protein into the muscle system. Now, with our protein options, it can be from animal-based sources or plant-based sources. The animal-based sources or the complete proteins are considered to be the more high-quality proteins because they give the body all of the essential amino acids that it does need, especially for the recovery process. Now, you may see that there are plant-based proteins out there. Usually they have a combination of different protein sources because it's different incomplete proteins that if you link them up together, they can then form complete proteins because they give the body all of the essential amino acids just from different sources. Now, with our animal-based proteins, the reason those tend to be more beneficial for our specific population is because they contain leucine in higher amounts, specifically whey or dairy-based proteins have more leucine, which is what we call an anabolic trigger. So that does tend to stimulate muscle protein synthesis better than any other amino acid. So if they are able to consume dairy or whey-based proteins, that will help them to build and maintain their muscle throughout the day. So as we said, our idea is to spread our protein intake throughout the day. when it comes to a hierarchy of needs for protein, getting enough protein overall is the most important thing. Spreading your protein intake throughout the day is the next most important thing. And then, if we can, trying to get the protein around your activity or around your rehab or your workouts is important, but it's not as important as getting the total amount of protein throughout the day and then spreading as evenly as we can. So if somebody's looking for protein, you can give them a rough idea of how much protein they need throughout the day, but really emphasizing high quality protein spread throughout the day is going to be very important. The next macronutrient we talk about is carbohydrate or our carbohydrates. Now, when it comes to physical activity, carbohydrates are king, as they say, because that's what our body runs on at high intensity exercise. But when we're less active, when we're recovering from injury, our carbohydrate demands do decrease, but not as much as most people think. We don't want to be necessarily switching to like a keto type diet or a very low carbohydrate type diet, because if we drastically reduce our carbohydrate intake, our body still needs some of the carbohydrates for fuel. And if we're not taking in the carbohydrates for fuel, that does tend to lead to more muscle breakdown. So to spare muscle breakdown, to spare protein, we do want to make sure we're still consuming adequate amounts of carbohydrates. Also, carbohydrates will help to support the immune system, which we'll need in the recovery process as well. So to give you an idea of how many carbohydrates an active individual usually consumes, that could be anywhere from 6 to 12 grams of carbohydrate per kilogram of body weight. So for somebody who's maybe playing football or lacrosse or field hockey or soccer, they may need like 6 to 8 grams of carbs per kilogram body weight per day versus a marathon runner who is doing 60, 70, 80 miles a week. They may need 8, 10, even 12 grams of carbs per kilogram of body weight per day. In the recovery phase, our demands again do decrease. Typically during a recovery, less active phase, we're looking at more like 3 to 5 grams of carbs per kilogram of body weight per day. So they do decrease by maybe a third to a half of what they were consuming before, but we still need to make sure we are consuming carbohydrates for that recovery process. The big emphasis should be focusing on more of your higher fiber, whole grain, nutrient rich carbohydrates, things like your whole grains, your vegetables, and your fruits, because we want to avoid those drastic decreases or increases and decreases in blood sugar, and simple sugars can be very pro-inflammatory inside the body. So we do want to focus more on your complex, slow digesting carbohydrates versus the simple carbs, which is what we'd be recommending for somebody who is active and using things like sports gels or Gatorades or other recovery products. So during exercise, the goal is simple, quick carbs pre, during, and post workout. When we're not necessarily exercising, a lot more emphasis goes on the more complex carbohydrates, more of the slow digesting carbs. Now, the last nutrient we talk about is fat. So fat, there isn't necessarily a specific recommendation as far as grams per kilogram of body weight for fat as there is for protein and for carbohydrates. It does just more fill in the energy gap. So it's not that it's not important, they just don't have as specific a recommendation when it comes to how much you need per kilogram of body weight. But with that, we do want to make sure that we are maintaining a good, healthy intake of fat in the recovery process because it's going to be important for the production of hormones, and also certain types of fats, as you probably know, are very anti-inflammatory inside the body, which will help to enhance the recovery process. So in general, fats are about 25 to 30% of your total calorie intake for the day. It really just makes up the gap for what you need in energy once you figure out how much carbs and how much protein you need. The emphasis for the fat should be more on your unsaturated fats. So things like olive oil, your olives in general, nuts, avocado, fatty fish. Those are going to be your anti-inflammatory options when it comes to the fat sources. So with our different unsaturated fats, we have our mono and our polyunsaturated fats. Those are important for the incorporating into the cell membrane, so they're more flexible and more rigid, so more nutrients can come in and out of the cells. There's a little bit of a controversy when it comes to your unsaturated fats, though. We have your polyunsaturated fats, which are your omega-3s, and your omega-6 fatty acids. And this is where a lot of people are having some of a conversation about the inflammatory process versus the anti-inflammatory process. So omega-3s tend to be more anti-inflammatory inside the body. So things like avocado oil or avocados, olive oils, fatty fish, flax seeds, and nuts. Those are the omega-3 fatty acids, which have much more of an anti-inflammatory effect on the body versus your omega-6. They tend to have more of an inflammatory effect on the body. So more processed meats, more of your greasy foods, or your vegetable oils. those then do tend to, like I said, increase inflammation. And a lot of people forget that we do need actually some inflammation inside the body. Some inflammation is good for starting the recovery process. The problem is when we have a disproportionate amount of your omega-6 to omega-3 fatty acids, that then causes too much inflammation. So it is important we do get some omega-6 fatty acids in the diet, but we don't want to have them as disproportionate as they are. The recommended amount is 1-to-4 ratio of omega-3 to omega-6 fatty acids, while the typical American consumes about 1-to-20 when it comes to their ratio of omega-3 to omega-6. So the concern isn't that we have omega-6 fatty acids from maybe your seed oils. The problem is we eat too much of the processed foods. So we do want to make sure we are choosing more omega-3 fatty acids than most people are consuming now, but we don't have to demonize the omega-6 fatty acids. They are good, just not having as much of them from the processed foods is a big emphasis for most people. So fat is essential. We just want to make sure that we are choosing the better types of fats, especially for recovery. More of the omega-3 fatty acids are key. So to put that into practice, if you want to give somebody a more practical idea of what that's going to look like, if you go to the International Olympic Committee, or sorry, the U.S. Olympic Committee, they do have these diagrams for free on their website. You can use this to kind of guide somebody as far as how much they need to be eating or what their plates should look like. So this is what we tell somebody that is an average in-season plate. Moderate training, about 2 to 3 hours a week, about 10 to 15, or sorry, 2 to 3 hours a day, 10 to 15 hours per week. It's a pretty simple breakdown. Third of the plate of protein, third of the plate of grains, third of the plate of vegetables, and about a tablespoon of your hard, healthy fats. For somebody who is exercising more, doing 4 or 5 hours a day, so somebody doing more endurance type exercising, or we think of like an athlete doing 2 days in the preseason, somebody doing more hard training or getting ready for a race, they're eating a much higher percentage of their plate from their grains. They're eating maybe a quarter plate of their plate as their vegetables and a quarter plate as their protein. And they are including a little bit more of the heart healthy fats because they do need more of the energy dense foods. So they are looking for a lot more calories per meal. What you'll most likely talk to somebody about is while they are injured, recovering, maybe in the off season, the big difference is the proportion of the grains to the vegetables. So typically, if somebody is not training more than 5 hours a week, or if they are recovering, if they're less mobile, the grains or the carbs are about a quarter of the plate. The vegetables and the fruits are at least half of the plate, and then the protein is between about a quarter to a third of the plate. Like I said, if we are recovering from injury, we would want to increase that protein a little bit more. So having a little bit larger portion of the protein on the plate would not be a bad idea if somebody is really looking to maintain their muscle mass as they're in their recovery process. And then fats, obviously, have decreased a little bit because we need less of the energy dense foods. So fats would be maybe a teaspoon versus 1 to 2 tablespoons on the other training plates. So again, if you want to use these, they're great visuals. You can find them from the U.S. Olympic Committee. They're free to download, and you can share them with the athletes if they're looking, or the active individuals if they're looking for more recommendations for that. The next thing we focus on is hydration. So I know there's a lot of words on here. I don't want to go through each one individually, but really emphasizing with active individuals that they need to stay hydrated for the recovery process. They're hopefully drinking a lot of fluid when they are playing sports or training for marathons or whatever else they're doing. But if they're less active, a lot of times they think that they need less fluid. We do want to make sure they understand that fluid is just as essential for recovery as it is for athletic performance, because it's going to allow them to drain the lymphatic system. It's going to allow for better circulation of your anti-inflammatory hormones. It's going to deliver more of your oxygen and your amino acids to your working muscles. It's going to keep your joints well lubricated. It's going to allow for more muscle protein synthesis and cellular repair. Fluid is very essential when it comes to the recovery process. We can't let them forget about it when they are not playing sports or actively involved in competition. So the general rule I give everyone is we do want to always try to drink at least half your body weight in fluid ounces every day. So that's a good guideline to start with, but most of the time they're looking to also incorporate about 2 to 3 cups per hour of activity, or if they are able to weigh themselves before and after their activity or their therapy, usually you're looking to incorporate 2 to 3 extra cups for every pound that they lose. Now, with this, they are sweating a lot, doing their extra rehab or their workouts. Not a bad idea to incorporate some of maybe the electrolyte replacers like a Propel or a G2 or Liquid IV if they are sweating a lot. Now, they don't necessarily need the full strength Gatorades with the more simple sugars, but they can use the electrolyte replacers to replace what they're losing through that sweat. Monitoring their hydration is easy if they can look at the color of their urine. Typically, we're recommending if your urine is the color of lemonade or lighter, you're hydrated, you're in the clear. If it's apple juice or darker, you're most likely on your way to dehydration. Now, a big thing is we're not looking for a completely clear urine. It doesn't have to look like just water coming out. You do want to have at least a little bit of color to it. Typically, if their urine is completely clear, they are actually a little bit overhydrated, and they would benefit from adding a little bit of electrolytes to their beverages throughout the day. Now, to talk a little bit more about specific injuries and what we might think about when it comes from a nutrition perspective, we break it down into the acute, subacute, and the rehabilitation phases. So within about a week after their injury, we focus more on the anti-inflammatory foods. We'll talk a little bit more about anti-inflammatory supplements later on, but we focus more on the foods that will give them more of the anti-inflammatory properties, fruits, vegetables, whole grains right after their injury. Avoiding high-dose NSAIDs or anti-inflammatory supplements because they can blunt the natural healing process. They can reduce the inflammation that we do need to start that process. In the subacute phase, which is usually between 1 to 6 weeks, we emphasize more protein, like we talked about, 1.6 to 2.2 grams per kilogram of body weight per day, making sure that they are also consuming enough energy and calories to prevent any additional muscle loss. We may consider at this point some additional supplements. So we'll talk about these in the next section, but something like creatine or collagen could be a good supplement to discuss with them if they are looking for something that can help the recovery process. And then long-term rehab, the goal is to support muscle hypertrophy, muscle building, making sure they're consuming, again, adequate amounts of protein, enough energy to sustain their activity level. Reinforcing at this point, proper hydration, a good balance of macronutrients, and then meal timing throughout the day and specifically around their therapy sessions. And then for brain injuries, it's important that we do look for concerns with somebody who may not be consuming enough, because we know with the brain injuries, there tends to be more headaches, more nausea, also reduced appetite. So there's a higher risk of underfueling for somebody who may have a concussion or is recovering from a brain injury. So if you do see that somebody is not eating enough because they are having frequent headaches or more nausea, this could also be a good reason to refer to a dietitian to talk about how to increase their nutrient intake if they're not feeling as hungry. But if you are able to address some of their nutrient concerns, really talk to them about the omega-3 fatty acids because of the neuroprotective abilities of it and the repair process. Encouraging something like a omega-3 fatty acid supplement if they don't eat a lot of fish is a good idea. And then also talking to them about the benefits of the heart healthy fats. Creatine, which again we'll talk about a little bit on I believe it's the next slide, that has also been found to improve cognitive function as well, help support brain metabolism. So there's a lot of emerging evidence that taking in creatine will help support recovery after brain injuries. The antioxidants like vitamin C, E, and curcumin and resveratrol, those can help to reduce the oxidative stress on the brain. And then zinc and magnesium are important for the neural repair and the mood regulation. And then, as we just talked about, hydration is essential for the brain perfusion and recovery. So making sure that they are always drinking at least half their body weight in fluid ounces every day is going to be essential for recovering after those brain injuries. So the last thing I want to really address as far as nutrition are some of the supplements that they may consider. Now, I'm not saying that you should be just going out and blanketly recommending supplements for everybody, but some people will ask about different supplements, and it's good for you to have the knowledge on it. The big thing with supplements before we talk about individual nutrients or supplements is just really knowing what you're looking at. If you're not familiar with sports supplements or ergogenic aids, the big concern with them is that they're not third-party tested. So that means they don't have, or sorry, they're not FDA regulated. So they don't have to be regulated or tested before they hit the market. So if somebody is saying that they're taking a recovery product, or if they say that they're using a protein powder, if they're just buying it off of Amazon, or if they're going to Walmart, or if they're buying it just off of any old website online, there's a very high risk that it could be contaminated or adulterated because it's not always tested. And a lot of times the companies are trying to find less expensive options, more effective options that might have additional stimulants or growth hormones in there. There could be what we call a proprietary blend, which is a mix of different ingredients that they don't have to specifically tell you the amounts of each ingredient in there, or there could be just errors. They've done some research that found that most sports supplements have anywhere between 15 to 500% of what's on the label actually in the product. So there is a great variability when it comes to the potency of those options. And if you are working with any active individuals who are susceptible to testing from the NCAA or WADA, it is very important that they are getting their products tested, because if they do get drug tested and they are found to be taking an illegal substance, even if it's unknown, then they could be banned from their sport. So it's very important we look for things like NSF Sports, that's the National Sanitation Foundation. They do have a specific certification for their sports products. That's to make sure that it's a good, safe, clean facility. Informed Sport is a company that really looks at the potency of what's in the product. So it makes sure that what's on the label is what's in the product. You can go right to their website and see a list of products that they test, and also gives you batch numbers. And then you can also look for the Banned Substance Control Group, Consumer Labs, and then USP. Those are all third-party testing options, which will give you the idea, will help you to know that it has been a tested product. It can't guarantee that it's safe for every individual, but at least it tells you that what's on the label is what's in the product. And for certain ones, again, it'll tell you that it contains no banned substances, so that it's good for those higher level athletes or individuals. So if people are wondering about supplements, one of the first ones that they have been really researching, or not that really researching, one that's been the most researched is creatine monohydrate. So this is the most well-researched ergogenic aid and sports supplement that there is. They've been doing research on it for 50 to 75 years. There's hundreds, if not thousands, of research articles on it, and they have found a lot of benefits for it. So most people think of taking creatine when they're going to be going to the gym and they're going to be doing Olympic lifting and they're trying to really focus on the power for their sports. But they found that the effects of creatine, as far as the benefits, go well beyond that. So yes, it does help to build muscle. It increases the activation of the satellite cells in your muscle tissues. It does help to increase the creatine phosphate content of your muscles for energy during high intensity exercise. But they have found that during times of immobilization, it also helps to preserve lean muscle tissue. And because your brain uses the creatine phosphate pathway as well, it does help with cognitive function, especially during sleep deprivation. And new research is also finding that it helps with your immune system as well. So creatine has a lot of benefits. I really emphasize this with a lot of individuals, whether they're active or not. Considering a creatine supplement is not a bad idea. It's not anything that is foreign to your body. Your body produces about 1 gram of creatine every single day in your liver and your kidneys. A typical diet contributes about 1 to 2 grams of creatine every day from animal products. So those who don't consume animal products are more at risk to be low in their creatine. So they would benefit more from a creatine supplement. So if somebody is considering creatine, again, make sure it's third-party tested. It is a good idea to have them get their blood work done ahead of time, just to make sure that they don't have concerns with their kidneys as far as filtering the breakdown product of creatine, which is creatinine out. So it is a good idea to get their blood work done before recommending that they do consider a creatine supplement. If they are looking into it, or if they're already taking it, then the typical dose is about 3 to 5 grams of creatine monohydrate 3 to 5 grams per day. And then there is what they call a loading phase, which is where you do 20 grams a day, so 4 doses of 5 grams each. That helps to supersaturate your muscles with creatine. Typically, they get saturated in about a week, versus not doing the loading phase takes about 3 to 4 weeks. Now, there is a newer form of creatine as well. It's called creatine HCl, creatine hydrochloride, and that is a much smaller molecule because it's not linked to water. It's actually more water soluble. It has been purported to be better absorbed and not cause as much water retention for some individuals. So it is new, it's being researched, but the gold standard when it comes to creatine is creatine monohydrate. Creatine HCl is an option, but if you're going to make a recommendation or talk to somebody about it, creatine monohydrate is where you want to start. The next supplement, newer, I'm sure most people have heard of it, it's very popular, is collagen. So collagen is a peptide, it's a short chain of amino acids, and it does help with improving your, obviously, hair, skin, and nails, which is why most people take it, but it's also good for ligament and tendon strength, it's good for joint function and pain reduction, helps with soft tissue healing, and it does have also an anti-inflammatory effect inside the body. So creatine, it's the most prevalent protein inside the body. About 30% of the proteins in the body are collagen, so it is essential and it's prevalent throughout the entire body. So we do get a lot of collagen from our animal products in the diet and things like bone broth. But again, somebody who's not eating any animal-based products may benefit from a collagen supplement, or somebody who is, again, having issues with their ACL or other ligament issues may benefit from supplementing with additional collagen. Now, taking vitamin C with the collagen also helps to increase the absorption of it and the integration into the collagen inside the body. So it is not a bad idea to have your collagen with either vitamin C rich foods, like it says citrus or bell peppers, or to take a vitamin C supplement along with it. The typical dose of your collagen would be about 15 to 20 grams of hydrolyzed collagen about 30 to 60 minutes before your workout or your physical therapy or rehab session. Taking it before you do your workout helps to absorb it more into the working muscle so you can incorporate it more into the areas we're focusing specifically on. Another thing to consider, like we talked about before, is omega-3 fatty acids. They do help with anti-inflammation inside the body, but also they have found that it enhances the anabolic sensitivity to amino acids, which will then in turn increase your muscle protein synthesis in your working muscles, and it can prevent muscle loss in your mobilized muscles. So it doesn't just help with the anti-inflammation, it will also help with building and maintaining muscle mass. So for somebody who is eating a lot of fatty fish and they do eat a very well-balanced diet and they have walnuts and chia seeds and flax seeds, we may not need to do a supplement. But for somebody who is not necessarily eating a lot of fish or they're not a fan of chia seeds, then it wouldn't hurt to consider a omega-3 fatty acid supplement or a fish oil supplement. So a typical dose for that is about 2,000 to 4,000 milligrams per day. One of the biggest concerns I hear with a lot of people taking fish oil supplements is when they do take them, they then get the fish burps because when the capsule is dissolved inside the stomach, it then gives them that bad taste when they burp. But they do say that I found that if you freeze it, it actually helps more because if it's frozen, it makes it through your stomach first. And then when it gets absorbed in your small intestine, it's already past where you're going to taste those fish burps. So if you do have anybody who's complaining about that, tell them to put their capsules in the freezer. It does nothing in the nutrient quality. It just allows them to digest it better before they would ever taste those fish burps. And then supplements, we always think about things like protein for an athlete after a workout when they're maybe going to class, but it's also good for the injury recovery, or if somebody's going from physical therapy or rehab right to class or right to work, we would be okay with using something like a good high quality protein powder. The nice thing about something like your whey protein, your casein protein, as we talked about before, they do have a higher leucine content, so that does help to stimulate muscle protein synthesis better. So whey is more of a quick digesting protein. That's something that we would want to use immediately after or before a rehab or a physical therapy session because we want to get the proteins into the muscles as soon as possible. Versus casein is a slow digesting protein that would be better for like a pre-bed feeding because that'll slowly dose your body with protein for about 6 to maybe 8 hours, depending on the type of casein protein it is. Again, if you are looking at an animal or a plant-based protein, usually you're going to have a blend of the different plant-based proteins like pea protein or soy protein or your even like potato proteins, pumpkin proteins. They've concentrated them enough that it does give you the adequate amount of protein. And then by combining those protein sources together, they give you those complete amino acids. So they still give you the protein. It just tends to not be as effective at muscle protein synthesis because it doesn't have as high of leucine content as your whey or your dairy-based proteins. Vitamin D, so it's something that we find a lot of people are low on. I do encourage everybody to get their vitamin D levels checked whenever I see them. And with this, we find that even though some people have sufficient vitamin D, they may not necessarily be deficient, they may not have enough for optimal health. So the recommendation for preventing deficiency is the 30 nanomoles per milliliter for vitamin D. But if you're looking for optimal health, performance, recovery, they found that even more, between 40 to 50 nanomoles per milliliter, is actually more beneficial for active individuals. Since we don't tend to get a lot of it in the diet, it's only really found in fatty fish, certain mushrooms that are exposed to sunlight, and the fortified cereals and dairy. You usually don't get a lot of it from the diet. So we would encourage most individuals to get their vitamin D levels checked. And from there, we can tell how much vitamin D they might need to supplement with. Typically between 1 to 4,000 IUs of vitamin D per day will help with adequate levels, and that'll help to improve bone recovery and also important for your muscle function and muscle recovery, and then also your immune system as well. A supplement that you may hear a little bit more about, but isn't as prevalent, is beta hydroxymethylbutyrate or HMB. So this is something they do use more in a clinical setting, mostly with more individual or mostly elderly individuals, but has become more popular with active individuals in recent years is using HMB because of what it helps do is preserve muscle mass, especially during mobilization. So athletes take this more so that they aren't as sore and they don't lose as much muscle mass or break down as much muscle during long, intense workouts. But it could be also something that is important for active individuals who are then going through the rehab. So if you are hearing somebody talk about HMB, this is again beta hydroxymethylbutyrate. It is more research in elderly individuals, but there has been some research in younger individuals as far as the ability to preserve muscle mass. So with this, a typical dose, if anybody is talking about it, is typically 3 grams per day. Typically, we're doing about 1.5 grams twice per day. If you can do it right before your workout session, that will also, again, incorporate more of it into the muscles and prevent more of that muscle breakdown and preserve more of that lean muscle tissue. And then the last supplement we talk about are the antioxidants. So as we kind of mentioned before, there is a natural inflammatory response in the body, which will help with our recovery process get started. So because of that, we don't want to necessarily supplement with high dose antioxidants right after the injury or right before they're about to go into, let's say, a surgery. We do want to focus more on the food options when it comes to the antioxidants. We can't really overdo antioxidants from food sources, but you can easily overdose with too much vitamin C or vitamin A or vitamin E, and it can actually hurt the recovery process and it can delay the natural recovery that's going to occur. So we don't recommend higher dose antioxidant supplements right away after an injury. Usually once their body has started the recovery process, the inflammation has started to subside a little bit more, then we want to focus on more of those antioxidant-rich foods and possibly antioxidant supplements. The main one being vitamin C. As I mentioned before, taking that with a collagen supplement will also stimulate the collagen synthesis inside the body and help incorporate the collagen into the muscle tissues as well. So but the antioxidants are important, but we don't want to overdo them, especially too early in that recovery process. So the main takeaways for today, again, energy needs need to be adjusted depending on how active they were before the injury or how severe their injury is. If you start to notice that somebody is looking like they're losing too much weight, if they're losing too much muscle, if they're avoiding certain foods, this would be some time to address, are you eating enough during the recovery process? The biggest focus would be looking at increasing lean protein to preserve muscle mass, decreasing overall carbohydrate intake, but focusing more on your complex carbs, and then incorporating more of the heart-healthy omega-3 fatty acids to help with the anti-inflammatory properties, but also maintaining muscle mass. Talked about before, food is a great option for most of your nutrients, but it is not a bad idea to consider things like collagen or creatine supplements if needed. And then if you're not ever sure what to do, this is where you would want to refer to a dietitian. Specifically, I'm a performance dietitian working with active individuals. So when to refer? If somebody has poor appetite, weight loss, or if you feel like they have a poor relationship with food, that's a great idea. You want to refer over to a dietitian. If they have restrictions, whether they're voluntary or involuntary, if they're following a vegan or a plant-based diet, or if they have specific food allergies, that's a good time to talk to a dietitian to make sure they're not missing important nutrients. If you see they have a reoccurring injury, if this is the second or third time you've seen somebody with a stress fracture, second or third time they have a stress fracture, then that would be a good time to refer over. Or if they're looking at supplements, or if they are a higher level athlete looking to return to play quickly, that would be a good time to have them meet with a dietitian. Now, I think this next slide actually has something on it that talks. Yeah. So I'm going to skip over that quick. It just talks about what a sports dietitian is going to do. So sports dietitians will help with determining energy needs, looking at their macronutrient breakdown, helping to determine a good eating schedule around their workouts, and then also helping to look at any kind of sports supplements and give them more guidance towards that. So if you would like to refer to a sports dietitian, I know I've sent a little bit of information about this previously. I'm not sure if everyone's seen it, but you can easily refer through Epic. So with this, you just provide an ambulatory referral to nutrition services. You can select specialty services requested and then just put in sports nutrition. Now at the bottom, it does say you can also refer directly to me. We're finding that if you do that, it doesn't actually show up in my work queue properly. So I wouldn't suggest referring to specifically me. I would say refer just to sports nutrition and then it will come to me. You can also send me a direct in basket or a message to let me know you're referring to somebody. That way I can let you know if the referral's been placed or not. Now, something I will say as far as referrals through Epic, I'll bill them through insurance when I meet with them, but it's not a guarantee that they're going to have insurance coverage for it because not all insurances are going to cover nutrition services for everybody. And then depending on the diagnosis, it may not be something that their insurance will cover for a dietitian visit. So if it is related to weight or diabetes or heart disease or kidney disease, then it's more likely that it'll be covered by their insurance. But if the referral's for knee pain, stress fractures, other musculoskeletal injuries, it's not a guarantee that their insurances will cover it. So if you're ever not sure if a patient is going to have insurance coverage for it, you can always send me a message and I can help look through the chart and see if it's something that we can find a diagnosis for that might be covered. Sometimes they'll also have preventative benefits, which I can talk to them about if you do refer them. We can then use a dietary counseling and surveillance code, which will use the preventative benefit option if they have that. Or if somebody just says, I don't really want to go through my insurance, if I know I'm not going to have coverage for it, we do also offer out of pocket options where if they're seen at one of our hospital settings, the out of pocket option is to pay $90 at the start of the visit. Or if they just say, I don't even want to go to hospital, I don't necessarily want to be referred, if they just have general nutrition questions that may not warrant a referral to a dietitian, we do also see individuals out of our fitness centers. So if you would refer them, I could see them at our West End Fitness Center, our Commerce Way Fitness Center, Anderson, or our Warren's Fitness Center, and that would be just $60 out of pocket if they wanted to have that as an option. So the best option is if you can refer them, we can use insurance, which is what most people would like to do, but again, if they don't want to go through insurance, if they don't have coverage, if they have a high deductible, anything that would limit them from seeing a dietitian in a more clinical-based setting, we also do non-clinical based options, just seeing them out of our fitness centers. If you have specific questions, feel free to reach out to me directly, either in basket, messaging, Teams, email, whatever you need to. I'm happy to answer any kind of questions about that. So to wrap things up, a well-balanced diet will enhance recovery, reduce inflammation, improve overall health outcomes for patients undergoing rehab or physical therapy, and physical therapists should have a good general understanding of proper nutrition to be able to answer basic nutrition-related questions and improve overall recovery. Hopefully for today, this gave you a good understanding of what those nutrition requirements will be. And again, if you have specific questions, I'm always more than happy to give resources or help answer questions or talk to you about complicated patients if you do see them. And there's my references. And now it's time for questions if we haven't.
Yeah. So feel free to either unmute yourself and ask, or type it into the chat as I'm monitoring the chat. While we're waiting for the first question, I do have a question.
Yes.
Earlier in the presentation, you mentioned like active individuals usually require about 40 kilograms or 40 kilocalories per kilogram. Since I'm not used to doing that calculation in my head, what would that be for like the average 150-pound or 200-pound person?
So for a 200-pound person, they would weigh roughly about, we'll say 80 kilograms. So we'll be looking at maybe 3,200 to 4,000 calories.
Okay. Cool. Thank you.
Yeah.
All right. And when you were mentioning about creatine,
yes.
Is there any advice on how much water you consume while how much hydration you maintain while taking creatine supplementation?
There's no specific recommendations for it. Like they don't specifically say you have to increase it by 25% or 20% or 2 cups or anything like that. But the problem is it tends to draw water into your muscles. So even if you're drinking the same amount of water, when you start taking creatine as you were before you started taking it, then we have less water for other parts of the body. That's why a lot of people tend to get headaches when they start taking creatine, is because it draws the water into your muscles and it doesn't allow it to get to your brain or your other tissues. So typically I encourage people just drink so you're not feeling thirsty anymore. If you just increase it by at least 1 or 2 cups a day, you should be completely fine. But there's no gold standard as far as how much fluid to increase. But generally I tell people, drink more water when you're taking creatine because you'll have some pulled into your muscles in the first place.
Okay, thanks.
And they do find that it also helps with cramping. So for anybody who's more prone to cramping, especially when they're sweating a lot, it actually, like I said, draws more water into the muscles. So if you have anybody who is cramping, taking a creatine supplement can actually prevent further cramps down the road.
Awesome. Thank you.
Sure.
What other questions do you have? Okay. Well, if you do have any other questions, please feel free to reach out to either directly to Elliot. And actually, there is a question.
Okay. Yeah.
Any specific supplement brands you recommend?
So big thing is going to, like I said, like one of those third-party testing options. So I personally like Optimum Nutrition. All of their products are third-party tested. They're all NSF certified. They're all Banned Substance Control Group certified as well. So I like Optimum Nutrition. They tend to have a very good, clean brand. Muscle Milk is very good as well. They do have a specific Collegiate brand, which is very well monitored for any kind of banned substances. And then also Naked Nutrition. They do have some good options. And then Momentous has some good options as well. But Optimum Nutrition is my personal favorite brand. If I buy creatine, it's that. If I buy protein powder, it's Optimum Nutrition. That's just kind of my go-to.
Okay, thank you.
And if anybody has any questions, you can email me directly, elliot.beadle1@sluhm.org, or if you just send an email to sportnutrition@sluhm.org, that goes to me directly as well.
All right. Well, thank you very much. Everybody, make sure you take the quiz and the course evaluation at the end of this, and which is through EADS, and reach out if you have any further questions. Thank you very much.
Thank you.